So, a pleasant morning or good day to you all, and especially to our proof Jufer Maninang. Today, we'll be discussing the topic what we have on global health and COVID-19 pandemic. So, first and foremost, if you have any questions or and regarding to our discussions before we start, and you may turn on your mic to address your concern, or if not, we proceed. So then, I acknowledge my group reporters as the following. First, I'm David Silva Lover, and together with Zao Met Oy, John Paul Silagan, Kenji Laurente, Bert Carl Anthony Bacalso, and also Stephen Kagingin. So, by the end of this topic, our objectives is students have more become knowledgeable about the current issues and the global health effects around the world, and also trace the history regions about the crisis issues, and describe how the issues related comes to the global health, and also last, explain the preventions of the said issues. So, in order to understand a broad concept like global health, it is important to consider where they come from. First, the history of global health has developed of two major trends. So, as this study we define as a Copland et al. Then that the history of global health, two major trends that shape global health organizations, including the control of infections, disease, and also the development healthcare system and structures. And that would be our foundations to discuss as global health. Firstly, what is health and what is global? Globe Specifically, global is a diverse and health in the simplest term of not being sick. So, the World Health Organizations, or the WHO, defines health as a state of complete physical and mental and social being, and not merely the absence of disease or infirmity. But what does this mean as a global health, as opposed to public health and international health? So, from that, we use the various resources as Copland et al. 2009. That the area of study of global health is emphasizes transnational health issues and determinants and solutions. From that, it is she discussed the involvement of many disciplines within the beyond of social science, and the promotions of interdisciplinary and multidisciplinary also further collaborations, and it is synthesis of population-based prevention with level of clinical care. So, in addition, according to Begley Hall and Bonita also 2010, went further to define global health as collaborative transnational research and action for promoting health for all and emphasizing need for collaborations. So, the difference between Copland and Begley Hall and Bonita, so it is global health as the diverse, and it is promoting need for collaboration to welfare everyone, or people, or country as a whole, everyone. Then, despite of that, as I said earlier, what does the mean global health as opposed to public health or international health? So, as we look in this table, this distinctive emphasizing by the Battens and Matlin as what is distinctive about the fields of global health. And also, apparently, these three health disciplines identifying the key concept characteristic of each and attempts to draw out the primary distinctions between these three terms. So by this table, we've seen the the geographical of global health is to emphasize the health issues that transcend of national boundaries, and also they cooperate as a global. So as a global health, they also, so we use the by the Battens Field and Matlin. So she discussed the national health of global health as a whole. Then the populations is preventions and clinical care and access, health equity among nations. So to all, as I said earlier, global health is as a whole to welfare everyone nations, and their disciplines is highly interdisciplinary and multidisciplinary. So international health, their geographical is focuses on the outside of one's and own country, and they cooperate as binational. So example of that, Philippines is a part of binational or international health, and their populations is prevention and clinical care, and also they access, help other nations. So they, as I said, of Bait and Bakley Hall and 2010s, he is emphasizing that the international health is discussed by the need for collaborations of other nations, so to health issues and social science. So their disciplines is embrace a few disciplines. And next, for the public health, the geographical is focuses on a specific communities or nations. They cooperate as national. Example of this is, Davao City is one of the part of, municipal city or cities is a part of public health. Focuses on, specific. So their populations is preventions and access, health equity within the nation or community. And their disciplines are interdisciplinary, participating with, social sciences. So there are, so this they this distinctive, distinctive global health field of Bethams and Matlin is, really, today exists. It is remain existence, this study, and this would be, our foundations to discuss our global health. And however, there are also a key principle of global health, and this would be discussed by our next reporters.
So here we have the 5 key principles of global health. I am Quetzal May Uy, your reporter for this topic. The first key principle of global health. It focuses on a public good. So it refers to a commodity or service that is made available to all members of a society. Second, believe in a global perspective. So global beliefs are widely encompassing assumption about the self, others, and the world. Third, it is a scientific and interdisciplinary approach. So interdisciplinary science is a collaborative process of interrogating knowledge or expertise from trained individuals of 2 or more disciplines, leveraging various perspectives, approaches, and research methods. So this is to provide advancement beyond the scope of one discipline's ability. Next, the need for multi-level approaches to intervention. So a multi-level model is offered, proposing that organizational learning is an interdependent system where effective leaders enact intervention strategies at the individual, network, and system levels. So, and lastly, need for comprehensive frameworks for health policies and financing. So health financing provides the resources and economic incentives for the operation of health system, and is a key determinant of health system performance in terms of equity, efficiency, and health outcomes. So culture, geography, demographic, economics, and gender all play a role in global health. The successful global health intervention necessitates a deep awareness, appreciation, and care for populations' social environments, including their habits, cultures, and beliefs. So when it comes to global health, it is crucial to remember that medical interventions aren't enough to tackle public health issues. So that's all for the global health. So thank you.
There are various examples of global health issues we have few experience nowadays, and these are emerging and re-emerging infectious diseases. First is antimicrobial resistance. Second is eradication of polio. Third is diarrhea, measles, and pneumonia in young children. Fourth, sexually transmitted infection in young women. Fifth is tuberculosis. Sixth is malaria. Seventh is HIV or AIDS. And lastly is parasitic infections such as hookworms. These are the emerging and emerging infectious diseases that have very big problem with global health issues. And then it's also essential to understand the links among health, education, development, poverty, and equality. Building on concepts in global health, one needs to have an understanding of how key health issues affect the different parts of the world and the world as a whole. These include environmental health, nutrition, reproductive health, child health, infectious disease, non-communicable diseases, and injuries. These concepts needs to have in global health issues of how the key health issue affect and this part of the world that needs to be a whole.
Thank you for that, Miss Silagan. As we reflect today, today issues or global health issues currently experience tremendous circumstances tackling the challenges of the world's leading cause of death and disease, which is COVID-19 pandemic, and to be addressed, and that would be addressing to our next topic, COVID-19 pandemic, and next reporter.
Good day, everyone. So, now we are the next reporters of this topic, which is COVID-19 pandemic. All of us know what is COVID-19 pandemic, and it still exceed 2 years until now. So, what is COVID-19 pandemic? Coronavirus disease COVID-19 is an infectious disease caused by SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. So, the COVID-19 is a infectious disease caused by SARS-CoV-2. So if we get this kind of virus, we experience mild to moderate symptoms, and it will lead to special treatment or require medical attention. So how it spreads? All of us know that this virus can spread through talking with someone without putting a mask in their mouth so that the small droplets that comes to our mouth will uh, received by the person who listens to you. And then, as we all know that uh, there are most common symptoms and less common symptoms of COVID-19 virus. So, what is the most common symptoms? The first one is the fever, next is cough, tiredness, and loss of taste or smell. Then the less common symptoms are sore throat, headache, aches and pain, diarrhea, a rash on skin, or discoloration of fingers or toes, and red or irritated eyes. So, where was COVID-19 pandemic first discovered? The first known infections from SARS-CoV-2 were discovered in Wuhan, China. It is the original source of viral transmission to humans remains unclear, as does whether the virus became pathogenic before or after the spillover event. So, the COVID-19 pandemic starts in Wuhan, China, and it is where the SARS-CoV-2 were discovered. So, the next is the statistics is will report by Mr. Bacalso. And that's for my report. Thank you.
Statistics. According to WHO or World Health Organization, the global number of confirmed COVID-19 cases and deaths reported to WHO has passed over 220 million cases and 4.5 million deaths. The situation is very different from region to region, country to country, province to province, and town to town. Some regions and countries continue to see step increase in cases and deaths, while in others they are declining. So, especially in the Philippines, in Luzon area, many people or confirmed cases because they didn't follow the safety protocol given by the government. And also many people deaths because they have own decision about their situation. Getting vaccinated, maintaining physical distancing, cleaning hands, avoiding crowded and closed spaces, and wearing a mask are anti-lockdown measure. They can prevent spread of disease without having to shut down large parts of the society. Good morning everyone. So talks about COVID-19 pandemic quarantine. Sedentary behavior and low levels of physical activity can have negative effects on the health, well-being, and quality of life of individuals. Self-quarantine can also cause additional stress and challenge the mental health of the citizen. So, ito yung may COVID-19 or mild symptoms ng COVID, dapat self-quarantine para for the sake of other people and also para dili mag-spread ang mga viruses. So, and also self-quarantine can not have physical activity like basketball, volleyball, kanang maka-exercise sa mong lawas para maunsa ka sa viruses, makalikay. So prevention of COVID-19 pandemic according to WHO or World Health Organization. So if you have a fever, cough, and difficulty breathing, seek medical attention or call in advance so your healthcare provider can direct you to the right health facility. This protects you and prevents the spread of viruses and other infection. So, prevention of COVID-19 pandemic is very helpful for us, especially today, para dili nata matakdan aning COVID kanang dapat magpatuo ta sa mga gingon sa doktor or mga health workers to prevent the spread of COVID-19. Maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. Wear a mask in public, especially indoors or when physical distancing is not possible. Choose open, well-ventilated spaces over closed ones. Open a window if indoors. Clean your hands often. Use soap and water or an alcohol-based hand rub. Get vaccinated when it's your turn. Follow local guidance about vaccination. Cover your nose and mouth with your bent elbow or tissue when you cough or sneeze. So, last, stay home if you feel unwell.
So, once again, good morning, everyone. This is the last topic of global health article about COVID-19 pandemic. The COVID-19 pandemic is one of the most catastrophic threats our planet has ever faced. It is first and foremost a human catastrophe with serious health and socioeconomic ramifications. The World Health Organization, which employs thousands of people, is on the front lines of the virus war, providing direction, training, equipment, and tangible life-saving services to member states and their societies, particularly the most vulnerable. When I visited the Democratic Republic of the Congo last year, I saw firsthand the heroism and dedication of employees who are fighting the terrible Ebola virus and perilous situations in very dangerous isolated areas. In addition, COVID-19 forced us to face our fears. This dreadful infection has infected each and every one of us. Following the procedure is the only way to keep this form from spreading. We can't allow this virus jump because people are dying. We need to put a stop to this. We can't just remain at home and do nothing all day because of the epidemic. Let's all obey the rules and maybe we'll be able to put an end this right away. So that would be all, sir. Thank you and God bless.
And we are Group H signing out.